I'm Judy McDonnell, and I'm a researcher with the Faculty of Health, School of Nursing at York University, and part of a project which is a collaboration between the Faculty of Health and the Faculty of Liberal Arts and Professional Studies, the School of Social Work.
So I'm Andrea Daly. I'm an associate professor at the School of Social Work at York University. At the school I teach a variety of courses on social work practice and theory. All of the courses are rooted in a focus on social justice and equity.
So there's lots of research to show that LGBT people, like other minority groups, experience ill health and health inequities, as well as barriers to service access. And while there's been lots of research in the hospital sector, there has really been very little about in-home care. And so this is a project on access to care for lesbians, gay men, bisexuals, and transgender people in Ontario, the LGBT Access Project.
We've developed a web-based survey for service providers to complete. And the survey asks the service providers about their experiences of working with LGBT people, whether they've had those experiences or not. And it also asks service providers about their experiences of access to diversity training and training in relation to working with LGBT people.
There's a $20 honorarium associated with completing the survey. At the end of the survey, there's a place where we'll ask service providers to include their contact information so that we can mail them a $20 check. And what we do is we've actually set up the survey in such a way that we can't connect respondents' answers to their contact information. So their survey responses, as well as they themselves as people, they remain anonymous. So we don't connect those two things. The other thing that we try to do is we don't ask any questions about the agency that service providers work in.
If you're a service provider who is currently working in home care, so if you're a personal support worker, a nurse, a social worker, an occupational therapist, physiotherapist, or a care coordinator working in home care, you can complete the survey by linking onto the website found at the bottom of your screen.
The second option is that service providers can actually complete a paper copy of the survey. So they can contact us either via email or over the phone and request that we send them a paper copy. And we'll do so. We'll send them all the materials that they need. We'll send them postage so that they can return the paper copies to us free of cost to them.
If you have questions about the project, you can contact me through a telephone at 647-236-1100 or by email at adaly@yorku.ca.